Hello, I am Dr. Leigh Erin Connealy, the Director of Cancer Center for Healing, and today I'm going to be sharing with you some great cases that I hope you can learn from. So one of the cases is a young lady. She was in her 20s, diagnosed with breast cancer 3 or 4 years ago, already had her breast removed, and she had chemo and radiation. So unfortunately, the cancer came back everywhere, bones, organs, everything. So she was told by her oncologist in Tennessee that she had 3 months to live and to go see a death counselor to prepare her. So she did a Zoom consult with me back in November 2019. And the case was quite serious and quite severe. So I said, okay, what is your will to live? That's the most important thing. So she said, I have the will to live and I have my entire church praying for me. So I said, okay, so what I would like you to do is I'm going to do some comprehensive blood testing first that you can get done in Tennessee. And then we need to do the RGCC blood test. The RGC blood test is a blood test that will check every agent, whether it's chemotherapy, whether it's small molecular weight or pharmaceuticals, or if it's estrogen blockers, or if it's immunotherapy. It will also check natural substances that work on the cancer. And does radiation or heat work? Now, she had already had radiation, and radiation is usually a one-stop treatment protocol. It's not something you do radiation on top of radiation. And then I said, okay, tell me about your stress levels. Well, she was presently separated away from her home and where she grew up, and she needed some assistance with that. So anyway, we got the blood testing. She came here to California and we began to do low dose chemo on her. We also had her, we evaluated her eating, got her on the best eating because she came in here 85 pounds in a wheelchair with her brother, very, very weak. All the staff here was very concerned about her well-being because she was so weak and so thin. So I gave her different supplements to help her gain weight. I used something called Genesis Rice Bran, which is a pure food to help her gain weight, instructed her on the best things to eat right now. And then we instituted low dose chemo right away. Now, the only reason we would use low dose chemo is to shrink tumor burden. Since the cancer was spread throughout her body, we needed to do low dose chemo to shrink the tumor burden because it was occupying a lot of her anatomy, therefore, really interfering with her function and activities of daily living. And so, sure enough, we did start that 1 day a week. We only used a very low dose because she was fragile to begin with. Now, along with that, we also, the day after chemo, we gave her an IV to rehabilitate the liver because chemo is very toxic to every part of the body, from the brain to the liver to the kidney to the immune system and everything. So we also gave specialized IVs, IV vitamin C, and different IVs that are also enhancing to help kill the cancer and also maybe to help the immune system. So we also did emotional work on her. We do something called EVOX because of her extreme stress of just her diagnosis, much less her personal stress. We did EVOX. So EVOX is a program where we have the patient talk and their brain is mapped out on a screen, and the practitioner identifies the areas that need to be worked on, and they start working with the patient and turning an emotional conflict resolving. And so that's a very important part of every patient's cancer journey, just because when you get diagnosed with cancer, it's very traumatic and dramatic. Not to mention our lifetime bioaccumulation of trauma that we've had since in utero or after we have lived life. And so we need to unravel those unfavorable emotional conflict and or trauma that we have experienced. We can actually use those traumas actually to help us. And so it's a very important treatment. The other thing I had her do was hyperbaric oxygen, because her hemoglobin was so low, and when your hemoglobin's low, you're delivering less oxygen and nutrients to your tissues. Now, another reason is cancer. Otto Warburg got a Nobel Prize in 1933 that cancer is a low oxygen, acidic, sugary environment. That's how they do a PET scan. The PET scan lights up, they give a radioactive sugar, and so that radioactive sugar lights up the areas that are active. And we had her PET scan to see all the areas in the body that lit up. So we did all of these supportive treatments, EVOX, low dose chemo once a week, IVs. We did lymphatic drainage on the patient because your lymph system helps remove garbage, and the body is making lots of garbage, as we know, every single day. And then we did the hyperbaric oxygen. We also did something called red light therapy. Red light therapy has over 30,000 studies on it to increase the ATP production of all the cells, especially the mitochondria. So the mitochondria that you have in every single cell help increase the production of ATP. And since she came in so weak and she's getting low dose chemo, you're destroying the mitochondria, so you've got to resurrect those mitochondria so the cells can take care of you. So we did 8 weeks of the chemo, along with all the supportive collaborative processes here at the clinic to get the patient's health in optimal state. And so we repeated a PET scan, and her PET scan came clear. And I always tell patients, a clear PET scan does not mean that the cancer is gone. Because why? A PET scan shows lesions, tumors, growths, whatever word you want to use, only 5 millimeters and above. So I said, now it's very, very important that we look and examine the underground functionality of every cell. So what I did is I told her, I said I want her to do acupuncture meridian assessment. Acupuncture meridian assessment is you have acupuncture points on your fingers and toes. You actually have many acupuncture points, but we take the top 50 on your hands and on your feet, and we measure the energy of the points to see what the energy is. And if the energy isn't there, we look and identify what is blocking the energy. And so we take those, I always tell people, it's like a wire from an organ, let's say it's heart or spleen or liver, and it's like a wire going, like a string of pearls, down to the acupuncture point. And then we identify those interference fields. And we also look at everything that may help the cancer get more under control. So we look at the imbalances, in her case, in the breast, but we check everything because we have to check everything, because cancer, as you know, has metastasized in this case. And so we got to look at all the organ systems and all the areas of possible metastasis. So the patient said, okay, this is great. I'm so excited about these new PET scan results. And she was thrilled and hugged and kissed me and everything. And I was very pleasantly surprised, okay? Because she's very young, and cancer in younger patients tends to be more aggressive. So she had to go take care of a few things in her personal life. She returned to Tennessee to take care and resolve a divorce that she had lingering. Then she went home to see her family, And then she decided to come back to California to do her follow-up. So upon her follow-up, she was a mess. She was, shortness of breath, can't eat anything, just full of anxiety. And I said, oh my goodness, what happened? So I think what happened is going home and taking care of divorce just brought up a lot of unfavorable situations for her. And so I said, oh my goodness, this is not good. So I said, okay, I want you to get some emotional work done. I want you to also, let's do some blood tests. So we did some blood tests, and it was rocky there for a couple of months. And then I started repeating. I was checking her blood every month. So I saw some of her markers go up, and I go, okay, something's going on here. So then after about 3 months, I decided, you know what, I'm going to repeat a PET scan. I repeated the PET scan, and some of her cancer came back. And I said, oh, we have to nip this in the bud. So we reinstituted low-dose chemo. And so she restarted low-dose chemo, and we repeated a scan approximately 6 weeks later, and her scan looked really good. And so now what we're doing, our tumor markers are coming down tremendously. And now because now we have a good PET scan, so we decided that we're going to do something called SOT. So that's supportive oligonucleotide technique to go after the circulating tumor cells, because circulating tumor cells don't respond to surgery, chemo, or radiation. And it's a treatment that is an individual treatment, meaning it deals with the DNA of the cancer cell of each individual person. So our GCC lab is the one that prepares it. So they take the circulating tumor cells, they reverse engineer a new messenger RNA to disrupt the DNA of the cancer cell. And that is given back as an IV to the patient. And that IV works 24 hours, 7 days a week, over about 4.5 to 5 months. We instituted that about 6 or 7 years ago and have had great success because it's so unique to the individual. And the future of cancer, I believe, will be analyzing the cancer genome, not the genetics of the cancer, of the patient, but the genetics of the cancer, and unraveling in that with different sorts of treatments. And so she will be getting that treatment, and she is alive and well and doing great now. She's 30 years old now, and she's actually gone back to her singing career and is going to be on America's Got Talent. So I want to talk about a patient that came to see me about 4 years ago, maybe 5 years ago, with new diagnosis of prostate cancer. Prostate cancer is probably one of the easiest cancers to treat, and it's usually, not always, the least aggressive. So this gentleman came in and he says, like, Dr. Connealy, I don't want to remove my prostate. I don't want to go through the complications of that. I just want to conservatively treat my cancer. So as we do with every single patient, we do a very, very panoramic view of all of the patient's blood work. So typically in oncology, they will draw a chemistry panel and a CBC. So the chemistry panel looks at your electrolytes in your kidney and your liver, and a CBC looks at, make sure that you're not anemic or your white count is okay. So in our clinic though, we want to look at everything that's going on with the cancer patient. Now in prostate cancer, I have a particular panel that I do, not just checking PSA, prostate specific antigen, because the developer of the PSA test says that's not a great indicator of disease or other issues. So he says really it's not a good marker. I have many a patient that has prostate cancer and their PSA is actually low. So again, I use other markers of the blood work. So one of the things I always like is C-reactive protein. I check all of their hormones. I check the hemoglobin A1C, which is a reflection of your sugar over 90 days, because the higher your sugar levels, the more predisposition to cancer and metastasis. I also will look at something called D-dimer. D-dimer is a blood test that tells me if the patient has a tendency to clot or the cancer's on the move. D-dimer, because 60% of patients that have cancer have a predisposition to clot. So I don't want to have to deal with the clotting and the cancer. So I want to make sure that that is in the normal range. The other thing is that D-dimer tells me that the cancer's on the move. Then I'll do a blood test called LDH, lactate dehydrogenase, and that will tell me if the patient maybe the cancer is progressively getting worse. Also, it's production of acidity. So we know that cancer patients, all of them pretty much tend to be acidic. So we need to check all of these things. Then I always do extensive nutrient testing because your nutrients are taking care of the cells. So if we don't have the proper nutritional status of the patient, how in the world would the immune system work to take care of the patient? Not to mention, how will the cell take care of itself without the adequate nutrition it needs? That test also tells me toxicity. It tells me the status of the gut. It will tell me the antioxidants. It'll tell me your minerals, your heavy metals. So it gives me a panoramic view of the biochemistry of the body. So then I ordered an MRI. An MRI will look at the prostate and it will tell me if there's nodules, what it looks like. Does it look like there's lymphadenopathy, lymph involved? And it might also tell me some of the bones in that geographical area where the prostate is. So I told the patient years ago that I went to a conference and there was a gentleman from Germany, Dr. Dow's, who talked about hyperthermia. Well, hyperthermia has been used for many, many years, has lots of documented medical studies on it. In the United States, we have radiation, which is a form of heat therapy, but we also have hyperthermia. There are some hyperthermia centers, but the hyperthermia in Germany is very, very, very studied, but it's also highly utilized all over. So this patient did some independent research on his own after I had mentioned it to him and decided to go to a clinic in Germany and get hyperthermia. So he decided he goes there for a week. He gets hyperthermia. He tells me, Dr. Connealy, it was very uneventful, very relaxing, no problems. And he chose that methodology because he did not want any of the injurious effects of radiation or surgery or cryotherapy, which is freezing the tumor. He wanted to go that there was no real side effects or downside. So he went to Germany, came back, and then I said, okay, we have to go after the circulating tumor cells. You've had your treatment in Germany, but let's go after the circulating tumor cells. So he had a blood test, RGCC, which I believe is the best oncological testing right now in the world. We can check circulating tumor cells here in the United States, but the laboratory, when I've done all the tests, they are not accurate, so I do not use them. So I checked for the circulating tumor cells. He had circulating tumor cells. Why are circulating tumor cells so important? Because they're responsible for 95% of metastasis, the cancer traveling to a new organ and establishing residence. So we don't want that. So what things work on circulating tumor cells? Only natural substances. RGCC gives me a comprehensive readout of all the substances that will efficaciously work on the circulating tumor cell. So we did that, and he started rotating the supplements. You don't take all the supplements at once. You do one substance at a time and rotate them monthly. Then he decided that he would do the SOT therapy along with it to ensure really good eradication of the circulating tumor cells. So we ordered the SOT therapy, which is the supportive oligonucleotide technique. It's very similar to what we call antisense in the United States. And so we did his therapy and gave him is IV therapy, which, like I said earlier, lasts for 4.5 to 5 months. Now, the other thing we did is the acupuncture meridian assessment. That is using the acupuncture points, looking at the underground things. I tell people when I do blood work and scans, I usually can't find everything that's wrong with you. I tell people when I do the acupuncture meridian assessment, it tells me the invisible that I can't find on urine tests, blood tests, and scans. And that's a test that I've been doing for about 23 years. And so I had been doing that, and he had been following the recommendations found on that testing. Whether it's toxicity, it may be candida, it might be parasites, it may be specific toxicity. So it's a very revealing of all the different things, and then you take care of, you take the recommended treatments, and then you repeat it in 4 to 6 months. And some patients only do it once a year, kind of like a pap smear, kind of like a mammogram, kind of like, blood testing. And so he is doing great and wonderful. He's followed the program very diligently, not perfectly. Perfection is never a good goal, but he has followed his program. He's very dedicated to his treatment protocol, but he is doing great and wonderful. And we are continually following with MRIs and complete blood work, and annually checking the circulating tumor cells. I like sharing these cancer survivor stories or cancer victor stories, so you can truly understand what's truly involved with the assessment of cancer. When patients get the diagnosis of cancer, they may be prescribed surgery or chemo and radiation. You may need surgery and you may need chemotherapy. You may need even radiation. But we have to understand the why, the where, the when, and how. How did this cancer start? We know that from one cancer cell to tumor formation, which is visualization by a scan, an MRI, an ultrasound, or PET scan, that took about 10 years. So that means 10 years of an environment or a terrain that created the cancer. So we have to understand why, where, when, and how you got the cancer to begin with. We have to look at all the facets. We can't just look at, okay, we're going to do surgery, chemo, and radiation. We have to unravel and understand every patient's root causes of their disease. That's why we do a very exhaustive blood work. That's why we do a nutritional panel. That's why we do emotional work on every single patient, because now all the studies that have come out say how much emotional conflict is causing disease. It starts in the head and ends in the body. And so if we do not do these things, so cancer is a lifestyle, environment, and what you eat. So if we don't address all these things every patient seeing the nutritionist. Now I have a lot of patients who are already have done great study of the way they eat and why they need to eat. It might be ketogenic, it may be paleo, it may be vegetarian. Really, there's no one size fits all when it comes to eating. But the single greatest determinant of health is really what you put in your mouth. I always tell people that food is information telling the cell what to do. So we need to eat the right information, the right food to tell our cells what to do. Then, because the environment is so toxic, every patient needs to do cleansing. So we have the patient do a 21-day cleanse. We have the patient do detox baths or infrared sauna. We have the patient do daily detox with different agents. And that's an ongoing process, unfortunately, because every day you're exposed to toxicity and it's impossible to eat perfectly. And so we've got to cleanse probably every day, unfortunately, because just the world we're living in. And so then we have the targeted nutrients that the patients need to go on. the specific anti-cancer or the supportive agents. It could be vitamin C, pancreatic enzymes that strip the coating of the cancer cell. We've got to give the patient something for acidity. We've got to look at all of their blood work, correct all the imbalances, not just some of the imbalances, all the imbalances of the body, correct all the nutritional deficiencies, and then give the patient the supportive treatments that they may need to take care of themselves. I'll be honest though, most of the things that you're going to do are your own self-care. So a lot of it is what you do at home, and then you may need heavy lifting with low-dose chemo, endolaser, hyperbaric oxygen, mistletoe. It just depends. There is no one size fits all. Red light therapy may be needed, lymphatic drainage. So these are the therapies that help accelerate the healing process. So you can see from these cases, these patients didn't do just one thing. It wasn't an overnight sensation. It was a very, very focused, with clarity and execution of their plan. And we're partners with the patient. We're not just the patient's doctor. We're partners with the patients, because the patients know and study a lot on their own, and they want to share with us what we've learned, and then we get them on the right path. So we want to partner with you to get you on the right path.